So I'm here with Jessica today, and Jessica, why don't you tell us just a little bit about, I guess, kind of your background, your history, how you came to our office, kind of really what prompted you to come to our office.
Sure. So I'd been suffering with a strange group, or just I had a lot of medical symptoms for a pretty prolonged period of time, with a couple severe, I would call them crashes.
Yeah.
The first time that it happened, it was actually a couple of years out of college. I started just having tons of strange anxiety symptoms, shaking symptoms, insomnia type symptoms, brain fog. My weight started fluctuating, not massively, but I lost a lot of weight and then gained it, and I just was not feeling well, to a point that was noticeable. It was noticeable to people who knew me. People were asking me, what was wrong, and I was going to doctors asking them what was wrong, and they were basically testing me and telling me, things like everything is fine, you should just exercise. Basically, giving me some very generic health advice. And I was a runner. I was running. I felt like I ate pretty healthy. I'd always been a healthy weight. I thought that I, cared about my health, and while I had some job-related stress, things like that, I definitely didn't feel like I should be experiencing the symptoms that I was. After a while, after the first, crash, a couple years out of college, I went to endocrinologists, a cardiologist. They were sending me to a lot of specialists, and I basically walked out of that situation with no treatments and no real understanding of what exactly was happening. I think I kind of finally just gave up going to doctors, and things did get a little bit better, naturally, to the point where I just sort of continued on with my life. But then again, maybe 4 years after that, another just massive, I would use the word debilitating crash of just extreme fatigue, muscle pain, crazy brain fog, crazy surges of adrenaline, having problems sleeping, where I just knew something was extremely wrong. This time when I went to my internal medicine doctor, they did a lot of tests on me, and again it came back and they just said, your cholesterol is a little high, but you're fine otherwise. And I just knew I was not fine. I just knew that I wasn't.
And
there was no way I was
fine.
fine.
It's so frustrating for so many women, especially your age too, that they go to doctors and hoping that they're going to get some answers, and they run very, very preliminary testing, and they don't kind of dig into really what are some of the common causes, or what is the contributing factors in this, and that leaves you so frustrated. And I know when you came at us, that's kind of how you felt. So go ahead. I'm sorry. You started telling us just about your experiences with doctors, and kind of how that was, and how did that leave you? I mean, where were you at that point in time, and how long ago was that?
I would say, the most recent period of time was maybe 8 months ago. That's when I think my health took a turn from having a lot of symptoms that were definitely impacting my life. They were definitely annoying, but at the same point in time, they weren't radically curtailing my plans. I was just getting on, and I also think it's that frog in hot boiling water. After a while, I realized I got used to more and more over time, and then I got a flu that was going around my workplace, and everybody else got it really bad and then recovered, and I got it just like they did, and afterward it was like I was so dysfunctional, it's like I could barely do my job, and considered having to leave, which is the last thing I would want to do. But the fatigue was just incredible. I was sleeping massive amounts of time. I had muscle pain, everything hurt, like my vision seemed foggy. So really where it left me was a lot of internet research, trying to figure out what was going on. But that's also hard, because I think there's a lot of, just panicked, paranoid people that you read these horrible stories about people never getting better and things like that online, and none of them are doctors. And
you took a little hiatus from work too as a result of that, right?
Yes, I actually had to stop working full time at my professional job. I ended up taking a restaurant industry, flexible position. Again, also hoping, I think since I wasn't getting answers, I was thinking maybe if I just reduced my stress, and just reduce my hours for a short period of time, I can go back to the professional world, especially just given I was young and healthy and used to being a runner, things like that, hoping it would snap back. And it was actually kind of horror. It was almost like, to my horror, it got worse. And that was also a huge wake-up call for me. There was no reason it should have gotten
that bad.
Yeah, exactly. It became so clear that I was so far from anything resembling what I would consider healthy.
Kind of fast forwarding a little bit, how long you've been under care in our office?
I started taking supplements here about 3 months ago. That was after all the testing that I got done here. So I would say about 4 months.
So you've been under care for about 4 months now. And what could you tell people that, in terms of just the progress that you've made, the results, and just your experiences here in our office? How do you feel today compared to 3 months ago? Do you feel a dramatic difference? I mean, what are the changes that you've noticed since you've been under care here?
Yeah, so there's definitely been, fortunately, there's definitely been improvements to how I was feeling before. I took all the testing that was recommended based on my symptoms and what I was experiencing. I think there were definitely some surprises in there for me in terms of what the results were. For me specifically, it was a lot of blood sugar things coming back, autoimmune things coming back that I hadn't heard of previously. And so working with those, I've definitely felt changes in my condition in terms of my general fatigue is. It's definitely not perfect. I'm still working on it, but it's not where I'd want it to be, but it's definitely a lot better, particularly compared to where it was about 6 months ago, which was basically that crash that prompted me to be doing the research I did to come here. So a lot less fatigue. I don't have the muscle pain. I don't have the brain fog anymore, which is also really relieving. And I generally feel like I'm on an upward spiral, whereas before I felt like I was on a
one of the most common symptoms that I hear over and over from people that have thyroid problems and Hashimotos is this debilitating brain fog. I mean, the inability to come up with words and articulating sentences and remember where you parked your car or where you put the TV remote, and just day-to-day tasks, of what you did and where you went and things like that. And so that was a big thing that was affecting you, wasn't it? That was
Yes. And it seemed like my vision was strangely blurry. I knew it wasn't really my vision, but it was not like being in a fog. Very, very frustrating. Very frustrating.
That's a whole lot better now, right? Your brain fog?
Yes. That, I would say, is almost completely improved. Along with the dietary changes and things like that, which I made, which again was also relieving because it's just nice to have one symptom just knocked.
Another common symptom that a lot of people with hypothyroidism have is like a lot of the muscle aches, and that's a big problem for a lot of people too. And so that has gotten quite a bit better for you as well, hasn't it?
Yes, that's gotten significantly better.
Joint pain, things like that.
Again, that's almost completely gone. There were times where I would feel it all day. Now sometimes I'll feel it when I'm extra fatigued and when I'm laying down and waking up, but it's not as severe and it's not all the time.
Well, that's great. Let me ask you this. Obviously, there's probably a lot of people that obviously will watch this video that are suffering with either some sort of autoimmune issue or a thyroid disorder or even Hashimoto's disease, and they may have gone through a conventional series of tests that really kind of revealed very similar things to what was revealed in your case, which was not a whole lot. And obviously, they're searching for obviously answers. What would you tell someone that is really searching for some answers in terms of getting to the root cause of why they feel the way they do, and what would you tell people about just your experience here in our office?
Sure, I would say if you
that's like a double question,
right? Very complex question. I would say that you know that there's something wrong with your body. I mean, your body will tell you. You'll know through these symptoms, and if you're going through the more normal, I would say, channels that you go through with your doctors, and you're getting the test, and you are being proactive and following up on it, and you're just not getting answers, you're not getting results. I mean, for me, that's what drove me into doing research and eventually finding this office and eventually coming in was, I mean, I knew that there was definitely something physically wrong with me, and without, being able to, I just felt very helpless in terms of I didn't feel like I was eating unhealthy, I didn't feel like I was living a healthy lifestyle. There was nothing more for me to do without having more answers. And if you feel that you're in that position, I definitely think that this office, there's a lot more testing options that I hadn't gotten, including from an endocrinologist that I went to, given a family history of thyroid disease. So I do feel like I was comprehensive in the doctors I went to before I came here, and there was a lot more testing that I got here, and there were answers coming back in terms of areas that were weaknesses in my health, discrepancies from what would be considered healthy, and then there were also supplements that I could take to start to remedy some of those. So I think there's other things out there than what you might initially consider.
I think for most people, I think they look at they're not looking for more medications. I think by and large, I think the vast majority of people are looking to take a very natural, holistic approach to restoring health and function. And unfortunately, there's really no disease where medication actually really makes us healthier. And so I think part of the reason why you also came into our office is you were looking for obviously a natural approach to really getting to the root cause and restoring function. And I think for so many people, they kind of go down that road thinking that one day they're going to wake up and the pills and medications that they're taking are going to be the answers to a lot of their symptoms and their poor health. And it's a sad thing, but more medication doesn't make us healthier; it makes us sicker. And I think that's so evident with so many of the people that really suffer with chronic health conditions, is that they're thinking that medicine is the answer. But yet the answer, if it was a lifestyle thing that lifestyle choices and some of those things that cause us to get sick, we've got to come back to those lifestyle choices in order for us to restore health. So I want to thank you so much for doing this testimonial. I really hope that the people that are out there and the viewers that are out there that are watching this testimonial can obviously take a lot of great a lot of the great things that you had to describe and talk about your own unique personal struggle, and how obviously that's turning around in such a short period of time. So I want to thank you for doing this. It means a lot to us. It means a lot to our staff, and we know that you're only going to continue to get better as time goes on.
Yep. Well, thank you.